Hi, good afternoon, everyone. Thanks so much for joining us. Today, we're going to be presenting a webinar, Preparing for and Responding to COVID-19 at Vermont Colleges. We're really excited to have everyone with us. Hopefully, we've got an audience from colleges and universities around Vermont, the communities nearby, and students and faculty. And we'll go to the next slide. So during this webinar, we're going to hear from Vermont colleges about their experience preparing for and managing cases of COVID-19 on campus. We're going to share an overview of the health department's contact tracing and outbreak prevention efforts on college campuses. And we're going to hear about testing in Vermont and get the latest on vaccine development. And finally, and very importantly, we're going to answer your questions. We had your questions submitted earlier this week. I believe people received a link and they could submit questions. We got a lot of them. And we grouped them by theme, and we will get to those toward the end. We've had a really great collaboration here at the Health Department. My name is Tracy Dolan. I'm the Deputy Commissioner of Health. We've had this wonderful collaboration since April, every week meeting with health leads across the state from colleges and universities, troubleshooting together, coming up with strategies, and eventually our reopening plan, which was very successful. Made successful not just by the health leads at colleges, not just by the health department, but also leaders in the community, students who have really dedicated themselves to these new efforts, faculty, and really just all the players involved really being on board. It's been very impressive. Our reopening plan, which was very successful, made successful not just by. All right, today's presenters from the Vermont colleges, we'll hear from Dr. Mark Peluso. He's the director for the Center of Health and Wellness at the Middlebury College. We'll hear from Dr. Michelle Pavola. She's the medical director at the Center for Health and Wellbeing from UVM. We will hear from Mary Mason, director of the Bergeron Wellness Center at St. Michael's College. We'll also hear from Annika Halkins-Hilke, a medical director at the Student Health Center at Champlain College. From the Department of Health, we'll hear from our commissioner, Dr. Mark Levine. I've already introduced myself, Tracy Dolan. I'm the Deputy Health Commissioner. You'll hear from me off and on today. Laura Ann Nicolai, our Deputy State Epidemiologist, will speak to us. Daniel Daltrey, he's a co-lead and a contact tracer, so you'll get kind of the firsthand information from him about the experiences of contact tracing. And then finally, Natalie Quitt, our outbreak prevention and response team lead. Just a short shout out here on our teams. Vermont, as you know, has had one of the most successful responses to this epidemic, obviously struggling like everyone else to manage cases, and of course early on to manage the cases in long-term care facilities. We did have some deaths, and every death, of course, is tragic, but overall we've had relatively high success. One of the drivers of that success has been our contact tracing team. CDC recently recognized our contact tracing team here at the Department of Health in Vermont as the strongest team in the country with the highest rate of contact tracing, reaching out to 92% within 24 hours of a case. And so just wanted to shout out to our contact tracers. All right, I'm going to hand over now to, I believe it is Dr. Mark Peluso. All right, thank you.
Thank you, Tracy. And I just want to take a moment on behalf of all the institutions of higher education in Vermont to thank you and Dr. Levine, as well as Dr. Patsy Kelso and Dr. Brina Holmes for joining us weekly since March to talk about COVID and how it impacts our colleges and communities. So where are we now? Well, we're in October and almost halfway through a fall semester, and certainly grateful for the opportunity to have students back on campus. We have learned a great deal since we began meeting with the health department back in March. But before I get going, I do want to note that each school is unique with respect to its geography, its resources, student expectations, and the policies they have to enact. So each school has to meet the Vermont requirements, but some schools also can create additional policies or procedures to meet their individual needs And so today really isn't intended to be a discussion on the differences between policies used at our individual institutions, but rather to review the similarities and basic principles that are keeping our campuses and surrounding communities as safe as possible. Maybe to the next slide, please. I think that many thought we wouldn't have students back coming to Vermont in September. In July, as you can see from this New York Times graphic from July 22nd, COVID cases in the U.S. were rapidly increasing, especially among young adults. The Northeast curve was actually low, but other areas of the country were certainly spiking, and there was a lot of concern about young people bringing illness into communities, especially college students traveling from high-risk areas. Even though we know that young adults tend to fare fairly well if they get COVID, we know that they can spread into other areas or into more vulnerable populations, and there was certainly a lot of concern. Next slide, please. The Vermont travel map from mid is what you see here, and red is bad, green is good, and this is a different graphic representation of what was going on right before students started coming back to our campuses. And there was certainly a great deal of public concern that the students would bring COVID from the red areas into the green areas and turn those green areas red. And our plans, we were monitoring this closely, and our plans had to take that surge into account, and they did. Next slide, please. As you can see from the bar chart on the top of the slide, if there had been an impact, we should have expected to see a spike over on the far right of that top bar chart by the yellow arrow, but that actually never happened, and we're fortunate. Next slide. So we continue to have, Vermont continues to have relatively low numbers of COVID across the state. I want to direct your attention to that middle map, which reflects the number of cases per county in the last 14 days. And you can see that, and this is from, I made this slide, I think on the 29th. At that point, most counties were in single digits of new cases in the previous 2 weeks, which is remarkable when you look at the rest of the country. So we can go to the next slide. So where are we now? I think we're in a unique position, kind of on par with the Northern Mariana Islands and American Samoa, as this NPR heat map illustrates. We're the only green areas in the U.S. country and territories. I think it's due to our planning, policies, and procedures that we, together with the Department of Health, created over the summer. One of those, some of that policy making had to do with robust arrival testing, and my colleague Mary Mason from St. Michael's will share some testing information with you now.
Thank you, Mark. So collectively, Vermont colleges and universities welcomed several thousand students to our campuses this fall. Each campus developed a set plan to address a safe return to campus, be it either bringing some back to campus. Well, we all brought people back to campus early if they needed to quarantine, and some campuses had students quarantine at home and travel directly here, and some had students self-test at home prior to coming back, and we all had some form of mass testing upon arrival. All of these efforts provided baseline data. So as you can see from the second bar on this graph, by September 4th, over 27,000 tests were done. And out of that number, we had 33 positive cases, which we managed on campus. Testing is done two ways, just to give you a little perspective. Surveillance testing, or testing of asymptomatic individuals, as well as diagnostic testing, or testing any individuals with symptoms. And that combination is displayed in this graph with the amount of tests done per week and positive results. And you can see with the cumulative tests done to date As of September 28th, we've performed over 81,000 tests collectively with a low total of 47 positive tests, which is a very low 0.06 positivity rate. Next slide, please. New England is also doing well as a whole, and here is how Vermont fares with our colleagues in Maine and New Hampshire. And again, these are tests done at institutes of higher education, colleges, and universities in New England. Next slide. And how do we compare to the rest of the nation? We are the lowest, as this slide highlights. Vermont compares. You can see Vermont currently remains the lowest, and indeed the national average is 13.9%, and Vermont is less than 1%. Next slide. You can access specific data for all institutes of higher education in Vermont through each school's website, which is listed here. We all have some sort of dashboard where we report total tests done with the amount of positive tests, and that's updated regularly. It's important to note, as Mark said, that schools do vary on their testing plans after the initial testing was done, but we all meet the same goal, which is to identify the virus early and respond accordingly. Testing is in fact only one piece of a multi-pronged approach that was carefully developed to reduce risk to our campus communities and the communities beyond us. I'd like to hand this over now to Dr. Michelle Pavola from UVM, who will speak more about the rest of the strategies to keep virus low on campuses.
Thank you, Mary. Good afternoon. So my name is Michelle Pavola. I am the medical director at the Center for Health and Wellbeing at UVM. I'm going to talk to you about how we got here. Representatives from Vermont's Department of Health, Department of Public Service, Agency of Education, Agency of Commerce and Community Development, and the state's colleges and universities all collaborated to create the Safe and Healthy Return to Campus Guide. Now, why did all these groups put so much time and effort into this over the past many months? Well, higher education institutions are an important component of Vermont's economy, its workforce development system, its culture, and its vitality. And these strict safety plans outlined in the guidance provided the framework for the many different colleges in Vermont to build their own versions of plans designed to protect the health and safety of the students, faculty, staff, and members of the surrounding communities. And I'm going to talk to you about that framework now. So there's 3 sections to this guide. The first section provides guidance around bringing students back to campus. The second area of the guide outlines the public health measures necessary to decrease transmission of COVID-19. And the third part covers ways to minimize spread and contain COVID-19. So let's start at the beginning. In preparation for students being back on campus, this guidance called for a change in the academic calendar to minimize students repeatedly leaving Vermont and coming back. Many colleges decided to shift classes to all remote after Thanksgiving break, allowing students to go home for the break and not have to return to campus for 2 more weeks of classes. Congregate living settings such as colleges, college dorms, and residence halls require additional measures to reduce the risk of COVID-19 exposure. So limiting visitors and reducing social gathering sizes are all examples of measures that can be used by institutions to reduce exposure of students to COVID-19 and then having it spread in a residence hall. So colleges were required to reduce on-campus events and gatherings. As a result, most of these were shifted to virtual events or canceled altogether. The guidance also required policies to curtail travel and visitors, both of which pose significant risks for bringing COVID to campus. Colleges had to develop health and safety contracts or commitments, pledges, promises. They all have different names. These would require students to abide by the state and institution's health policies, and violations of these would have to be enforced. Also, this guidance called for the creation of a health screening survey to require students to verify they are free of COVID-like symptoms before coming to campus. Now, how do we bring students to Vermont from so many states with more COVID than us, as the map that Dr. Peluso showed? And how do we safely incorporate them into our community? This called for strict guidelines around the arrival process that have been mentioned previously. So, quarantine rules for students were established based on where they were coming from and how they were getting here. Some students had to quarantine before they arrived, others had to quarantine after they arrived, and some did not have to quarantine at all. Testing every student's COVID status on the day they arrived on campus allowed us to identify which students came to us already having COVID and isolate them during their infectious period. And given that most people will develop symptoms within 5 days of exposure to the virus, a test on day 7 allows us to identify students who arrive infected with the virus, but at previously undetectable levels. Now, the second part of the Safe and Healthy Return to Campus guidance details the effective public health measures to decrease transmission of COVID-19. These measures include making face coverings a mandatory part of campus life. Now, despite initial concerns and reports that masks may not prevent the spread of COVID-19, masks are now recommended by the CDC and Vermont Department of Health and are one of the primary preventive measures used to minimize the spread of this illness. Colleges also had to ensure widespread access to and use of hand sanitizing supplies and an increased vigilance around cleaning and disinfecting. We also had to develop strategies to meet the specific needs of students, faculty, and staff who are at increased risk of severe symptoms with COVID-19. An important part of the guidance was maintaining 6 feet of physical distance. That is another important public health measure that was mandated. So important and time-consuming tasks were required to shift how campus physical spaces are occupied and used. And this was accomplished by limiting dorm rooms to a maximum of 2 students to reduce density of residential halls, reducing capacity of libraries to 50% of the fire capacity, and no more than 75 people in a discrete area of the library. At UVM, we're now allowing more than 75 people per floor. We're modifying dining services to allow for more takeaway options and arranging seating to allow for students to stay 6 feet apart while eating, minimizing the number of students on buses and in vehicles, and designing classrooms to ensure 6 feet of distance between students and creating course schedules to allow for decreased class sizes. UVM was able to accomplish this by shifting larger classes to remote learning, moving classes into larger spaces and decreasing the number of students in each classroom. And this was no small feat for the universities and colleges. Colleges were also advised to change the rules around activities with more risk, like athletics and performing arts. These activities are woven into the fabric of college life, but have great potential for spreading COVID-19. The last area of the guide addresses the containment procedures colleges need to employ to respond to positive cases. These guidelines help us prepare for positive cases by mandating that we reserve space to isolate and quarantine up to 5% of our college populations. It also directed institutions to ensure our college health services have adequate staff, adequate personal protective equipment, and access to testing. And this is where the strong partnership between the Department of Health and the college has really proven successful. Colleges in Vermont are not on their own, unlike in some other states. We know the Department of Health is there to coordinate and collaborate with every step when there's a positive case or if there's an outbreak. Daniel, Natalie, and Laura Ann will be talking to you more about these specifics later. Next slide. Our students are doing a great job following these guidelines while they're on campus because they want to be here in Vermont and in the learning environments Vermont's colleges and universities provide. In this WCAX news story from September 19th, several UVM students acknowledge that on the whole, their fellow classmates are following the state guidelines, including wearing face coverings, not attending or hosting large gatherings, and maintaining physical distance while still trying to connect socially. Whether it's UVM's Green and Gold Promise, Champlain's Community Health Pledge, or Bennington College's Commitment of Shared Responsibility, all of Vermont's colleges and universities have followed the strict mandates that I've outlined of the safe and healthy return to campus to try to ensure that the thousands of students who are here and clearly motivated to make these lifestyle adjustments get to stay here, learn, and grow. And I'll turn it over to you now, Annika.
Thank you, Michelle. So we would like to look ahead now and take a few minutes to share what we as a state are preparing for over the next few months. Next slide, please. Thank you. So we've all been hearing, reading, and anticipating this next wave or the fall surge since last spring. Well, the fall surge is upon us, and we are all starting to see surges really all around the world. As this graph shows, the US, Europe, and Canada, as well as other regions of the world not included in this New York Times graph, are all starting to experience significant increases in new cases. While the US is quite clearly beginning a fall surge, there is notable variation in trends by region. Next slide, please. You can see here that in our region, the Northeast, depicted in the red line, we have actually remained both stable and comparatively low. Next slide. So this next slide shows the Vermont forecast, and this forecast is based upon the Oliver Wyman forecast model, which is the modeling that Vermont has found to be a helpful tool in state planning. This model does predict an increase in cases over the next month, and while it is indeed a statistically significant increase, with cases more than doubling before leveling off in late October, we are doubling a very low number, with that increase still being a comparatively few number of cases by late October, early November. That said, we are all concerned and highly attentive to these increases and extremely aware that diligent planning and responsible behaviors are essential to avoid our own surge. From the college and university perspective, we are all taking these projections into account as we plan for a safe completion of our fall semester and start of our spring semesters. We are all already deep in this planning, and each school needs to develop an individual plan that is safest for their community. It would certainly be reasonable to assume that across the state, we will be implementing similar approaches that we used this fall, with arrival testing, likely compressed semester schedules, and diligent adherence to our health pledges that Michelle spoke about. Decisions about the spring semester are in the works now, emphasizing planning ahead while also learning more about how the pandemic will evolve this fall. We do know that spring break is on everyone's mind, and while I will refrain from anticipating school decisions, I will say we are all keenly aware that travel to and from Vermont introduces one of our greatest risks, and the desire for a spring break must be weighed heavily against the significant risk a break may expose us to with significant travel to and from the state. Next slide. And we can turn it over now to the my health department colleagues.
Thank you. Thank you greatly for that. And I want to share with you, this is Daniel Daltrey from the Vermont Department of Health, and I want to share a little bit about what we've been doing in terms of contact tracing. Certainly, contact tracing is not new to the Vermont Department of Health. I have been doing it here in Vermont since 2006. Granted, we have not been doing it on COVID since that time. That only just begun. Tempted to sing the Carpenters here to you, but I won't. With COVID, it has only just begun in March. So we have been doing contact tracing. We have a proven history of doing contact tracing with various other infections. We are doing it here now with COVID. And contact tracing is really just a part of the response that we have been doing with colleges and universities, higher education learning institutions. It is but a part of the continuum of services the Vermont Department of Health offers in terms of primary, secondary, and tertiary prevention, right? But it must be said, the work that we are doing would be nothing without the university partnership that we have experienced since coming back to school. The universities and colleges are doing something in tandem with the Department of Health that is working. We have had greater than 30 cases. We have had greater than 200 contacts, but we are containing this virus. We have yet to see student-to-student transmission. Often this is looking like something that has come from individuals' respective states or travel, right? We are doing something really good in the higher education learning community, and that is a partnership of what we have with the colleges and universities. But as I mentioned, contact tracing, there are other dimensions we need to think about. The importance of leveraging isolation and quarantine as soon as possible. You know, getting individuals out of circulation, stopping the spread, containing the virus, doing the best that we can. What we learn from an investigation of a student is something that we will pass on to our outbreak and prevention response. Right after me, you'll have the joy of hearing from my colleague Natalie to explain a little bit more about what outbreak and prevention response looks like. But let me talk more about what it is I know. And that is in regards to not just isolation and quarantine that we leverage through contact tracing, but really trying to leverage a medical intervention. So to go a little bit further, and that's through testing, to go a little bit deeper into contact tracing, next slide, please. I just want to lay out what it is that we do with universities. What we are doing with universities, as soon as we find out about a positive case, our contact tracers are contacting directly the individual and finding out more about this situation. In the meantime, there is an administrative lead within the contact tracing program that is reaching out to the college or university, finding out further about the dynamics involved with the student, trying to understand what their class schedule might look like, what underlying health conditions they may have, whether they're on campus, off campus, anything that the university knows. We get back with the contact tracer, find out the information, we work the respective contacts, and then we come back to developing a plan with the university or college about how do we move forward, isolate and quarantine respective diagnosed individuals as well as respective close contacts. Our universities and colleges are setting us up well. What we learn in the field, we create a feedback loop with our universities and make sure that after we've had that kickoff call and learn more information about the student, then we interview the student. What we learn from the student in terms of contacts, we feed back to the university and college. We try to support the learning community. It's something, I'd like to equate it to PPE, that is RTG. What do I mean by that? We are developing a plan with the university. We are leveraging personalized risk assessment with students and their respective contacts. We are having then an exchange with universities. Dan, what does the RTG stand for? We are ready to go. Whether these cases are coming in on a Friday at 4 o'clock or a Saturday at 3 o'clock, we have been in constant communication with our universities. We are ready to go to support our higher education learning institutions when and how cases happen. And thus far, I think we have been effective. But it's not to say that outbreaks might not happen. And to that, I want to hand this over to my trusted colleague, Natalie Quitt.
Thanks, Daniel. Natalie Quitt here, and I work on the outbreak prevention and response team at the health department. Whereas I like to see contact tracing team, they work on the individual approach and their contacts. We work on a facility-based approach to prevent and respond to outbreaks. And an outbreak is not exactly what you might think it is. It's when 2 or more cases are identified in a similar setting. And those cases are connected to each other, and they have no other more likely source of exposure to COVID-19, like in other settings, like their homes or in the community. So we are activated after Daniel's team, Contact Tracing, has done an initial case investigation for cases in settings with outbreak potential, which are most congregate settings. In colleges, this means places like dormitories and classrooms. And we then work with the facility to information gather and assess infection control practices and risk to others in that setting. We use tools like line lists, which are lists of all people who may have had contact with a case, and broader testing on a case-by-case basis. And these tools help us make recommendations to individuals by the contact tracing team. We pass off our line lists and findings to them and to the facility to help prevent or contain outbreaks. And decisions on outbreak mitigation steps like moving to remote learning and broader testing strategies is always made in partnership with college representatives and other teams at the health department. Every situation is different, so requires a tailored response. Thank you.
Hi, everyone. My name is Laura Ann Nicolai, and I'm the Deputy State Epidemiologist here at the Health Department. And for this COVID response, I'm the Epidemiology Branch Chief, leading our multiple epi teams that are responding to this situation. And so I'm just going to talk to you for a minute about testing. And so as Mary mentioned earlier, colleges are utilizing surveillance testing for their communities, which is a bit different than what the health department recommends for the general population. So for the general population, while anyone can get tested, not everyone needs to get tested. Testing is recommended for anyone who has symptoms of COVID-19, and then people who have had close contact. And we define close contact as within 6 feet for about 15 minutes or more. So anyone who's had close contact with someone who has tested positive for COVID-19, and then also people who are referred by their healthcare provider for testing for another reason. It's important to note that if you are identified as a contact of a case, you will be notified by a member of our health department contact tracing team, and they'll provide guidance on when you should be tested and what testing opportunities are available. So that timing is really key. In general, if you remain asymptomatic, that means getting tested at day 7 or later following your last exposure. So while testing is obviously very crucial, it's an important weapon in our arsenal against COVID-19, it does have limitations. Testing only reveals risk for a particular point in time. It is not a prevention strategy. So communities and schools who perform testing definitely still need to employ mitigation efforts like wearing masks, physical distancing, implementing limitations on the size of a gathering, spending time outdoors as much as possible. So those are all crucial, and institutions that have been doing frequent testing have still experienced outbreaks of illness on campus without those additional, mitigation activities. Would also just like to point you to this last bullet, which is a hyperlink to some new guidance that CDC has just released about testing for colleges. And now I think I'm going to turn it over to our Health Commissioner, Dr. Levine.
Hi, everybody. I get to talk about vaccines today. I'm going to try to be brief so we have abundant time for questions and answers. When we talk about vaccine candidates, those are what pharmaceutical companies are currently working with to try to find the right vaccine that will have both the safety and efficacy needed to handle COVID-19 on a population-wide basis. Any vaccine that any of us may have been given in our life really is, the principle is that there are proteins. We're made up of proteins, and so are viruses. They often have protein coats, like the spike proteins that you see on those famous pictures of coronavirus. You can call a protein an antigen. which means it's something that tries to stimulate our immune system and that we then form antibodies against. And for the sake of this conversation, there are two types of vaccines. One is what we would call protein-based, where you're actually injecting the antigen or protein into our body, and we're trying to make antibodies against it. Think about the flu vaccine. That's a killed, inactivated vaccine of proteins. Or think about hepatitis B or papillomavirus, HPV. Those are virus subunits that are injected into our body. The second type are more gene-based, where they actually carry the genetic instructions for the host cell to make the protein or the antigen. And the one that's becoming famous right now is messenger RNA. An example of what we're using all the time in medicine is the measles, mumps, and rubella vaccine, MMR, which is a live attenuated vaccine that, again, carries the genetic instructions into our cells. So if you know about DNA, then RNA, then protein. So if we have an mRNA vaccine, it will deliver the genetic material that will help our own body make the protein, and then we'll make the antibody against the protein. These are clinically unproven, but the big focus of interest with the coronavirus vaccine development. So suffice it to say, there's a horse race going on, and many of the horses are going to make it to the finish line. Many of the horses are going to break a leg and never get there. And many of the horses have a lot of money bet on them right now. And some of that money is really big US government money that's helping these companies invest sufficiently to try to get to the finish line with what the government is betting will be the more successful candidates. But there's at least 9 that are really under serious interest, but then there are multiple others that are also just not being written about a lot. And then there are vaccines that are in totally different countries of the world. Though politics has taken a hold here, suffice it to say that a vaccine will not be unleashed on the population if it is not effective against the virus and if it is not safe. Now, safe doesn't mean it won't have any side effects, because there's side effects to everything, like discomfort where the injection is, things of that sort, but it will not have any serious side effects. And though politics, again, has been in the news, there may well be one of these vaccine candidates before the end of the calendar year, but the reality is the majority of them will be after 2021 begins. And even if one is available this calendar year, there will not be sufficient doses to have it delivered to the population in a widespread manner. Keep in mind that all of these vaccines have different characteristics in terms of how many doses will a person need to receive to gain immunity. It's usually either 1 or 2, but most have been 2 lately. So there is one that's getting some traction that only has 1 dose necessity that people are very interested in. What kind of storage do they need? Some need a refrigerator, some need a very deep freeze. What kind of transport do they need, etc. So a lot of factors will be out there when the vaccines eventually become available. And when they become available, they will certainly start out with a prioritization scheme, because there won't be enough hundreds of millions of doses to deliver. And the usual priority groupings are to start with the healthcare workforce so that they are safe and can continue to deliver care to the population, and then to the more vulnerable. And in this setting, vulnerable often means older or having an immune compromising condition. But beyond that, it should be available to the general population. And then the final point I'll make on this slide is just that though there's a lot of work that needs to go into figuring all of this out, as a health department and as a state, we have to have all of the right logistics and strategies to deliver the vaccine preset and understood. We have to have good communication programs. We have to have good information technology to support. All of that, we are confident will be ready long before the vaccine is actually available to us. We can move on next to the next slide. And I guess Jillian will direct us through this, or Tracy will direct us through this.
Thank you, Dr. Levine. Yes, we're on to our questions and answers. In an ideal world, you'd be calling in and chatting with us, but we have a big group, and so we decided to do some thinking ahead of time, and so we could get all the best answers to your questions. Again, we received a lot of questions, and then we grouped them according to theme. There were some that were very specific, and so we chose not to answer those in this environment. And let's move on to the next slide, please. So I'll read these out, and we'll see who picks them up. How does a contact tracer consider a classroom exposure with respect to students and teachers being in close contact, being a close contact? And I think I'll hand that off to our health department folks. I think that might be Daniel.
Sure thing. And Natalie, please weigh in here as well. One of the things that I would point out is that we are looking at duration, proximity, and mask wearing. So if, you know, it was a class that was 2 hours or less, everybody was masked, there was distancing kept, we really wouldn't think of individuals as being close contact. We try to walk through with the university or even professors what the classroom dynamics look like, what is the size, what is the HVAC system, what is the length. A number of factors go into it. So as my colleague Natalie pointed out, though, it really is a case-by-case scenario. We don't have a set litmus test that will say instantly close contact, unless it is, you know, somebody was sitting less than 6 feet from somebody for greater than 15 minutes. So we've got to balance what we know in terms of the definition of close contact, but we also have to begin to factor in cumulative exposure. And so we will walk through that with the university as well as the professors when situations do arise.
Daniel, there's a follow-up question here, and I think you really may have covered it. What's the risk to a faculty member teaching a couple of in-person courses a semester, 1 or 2 in-person courses in a semester? And how does that compare to a coach, cashier, or custodian? I think this brings us to the same idea of duration and contact.
Yes.
Okay, so no new information there. Thank you.
No.
All right, why are Vermont colleges continuing restrictive measures like travel and visitor restrictions when the number of infections are so low? And I'll ask, go ahead, yes.
I think that's me. It's Mary Mason.
Thank you.
So our infections are low, and that's great. But testing is not prevention. So testing provides us data on how well we are doing with all of our other measures. And we know through this that these measures are working. So we will continue to employ things like physical distancing, wearing masks, limiting travel, keeping students here while they're here, limiting visitors, because we know it has worked and should continue to work to keep them here safely and keep our community safe for which they do interact.
Sure, there were 2 more questions and I think we've answered them. The second was college-age students don't seem to get too sick from COVID-19. Rates seem really low right now. Why are Vermont colleges being so conservative? I think we just answered that. And then, you know, just a cautionary note that while most college-age students don't get too sick, we also know that it is possible for a young person to get very ill. This is still a serious disease and we're taking it very seriously. Why not just test everyone multiple times a week and let them live normally? I think you spoke, Mary, to the point that testing is not prevention. So again, testing gives you a point in time. But as Dr. Levine repeats in his press conferences, the real prevention is the behaviors that we're doing in advance of testing, the distancing, the mask, staying home when you're sick. So I think we'll move to the next one. Thank you. Are Vermont colleges aware of the mental health impact the restrictions are having on students?
Tracy, this is Mark Peluso from Middlebury College. I'd like to take a shot at answering that one. We are absolutely, and I can speak for my colleagues from our other institutions, we are absolutely aware of the mental health impact that these restrictions are having on students. The colleges across the country, colleges are already increasing support for student mental health needs prior to COVID. And so mental health is really always on our mind and weighs heavily in our decision making. I think when I think about how to answer this question, I think back to something that our college president, Lori Patton, said about the decision to either open or not open back in early August. And she said there's an ethics to opening and there's an ethics to not opening, meaning I think there's a balance that has to be considered. And with mental health, I think we have to balance the restrictions that we have to put on our students to ensure safety and the impacts those have against the impacts that having COVID cases on campus might have. For example, there are stresses to navigating in-person, remote, and hybrid classes. That's all new for them. There are the visitor and travel restrictions, arrival testing, and in some cases other testing that they have to go to, grab-and-go meals, constant grab-and-go meals, not sitting in a dining hall and decompressing with their friends at the end of the day, wearing face coverings all the time, or just even worrying about if they have their face covering. And interestingly, there's a deep fear of not wanting to be the one that brings COVID to campus. That's very real. On the other hand, I think there are other stresses when we think about if we were more relaxed and we would expect to see more cases potentially. Then there are the stresses and impacts of isolation and quarantine. And campuses would have to then get more restrictive anyway if cases start happening and start employing more restrictive measures. And then we have cases on top of that. And also the concern about infecting others is very real and will become more real for students when they start thinking about heading home in September and wondering, am I going to bring COVID to my house or wherever I'm headed in November? I think it's interesting that a survey of Middlebury students in early August showed that the students our students were, and I think it's true for many students, they were really concerned about infecting others in their communities more so than being infected themselves. They rated community spread higher than getting infected themselves, which is, I think, very. I think the bottom line is, I think it's not easy to be a college student right now, and I think for a lot of students, college is their home or the place where they feel safe. They have food security here, they have reliable internet access, and hopefully an education that helps them to achieve where they want to go and their dreams. And I think for now, most, if not all, colleges are realizing that congregate living and shared dining and the developmental age and social needs of our students require measures to ensure the safety of the campus and the surrounding communities. And so I think either path is stressful, but the Vermont colleges, our colleges, are choosing the path that ensures the highest level of health and safety for all, but it is certainly not easy.
All right, I think we're moving on to the next question. How would Vermont colleges and the Department of Health work together with a local town in the event that there was an outbreak of COVID-19 on a campus? So this is an outbreak question. We'll send it over to VDH.
Tracy, this is Annika from Champlain. I'll jump in on this one. Sure. I think Natalie really actually covered this question very well already in her slide about outbreaks. Yes. And I think the important message here is that the Vermont Health Department and all of the Vermont colleges and universities are already working very closely together. As we've said earlier, we meet already for an hour every week, in addition to multiple emails and phone calls and exchanges of information to be ready for this. And we would certainly continue to do this work very, very intimately in the situation of an outbreak. Local towns and in reality, I think our entire state would be notified promptly about an outbreak through established emergency notification plans. And I think an important point here too is what several of us have already mentioned, including Mark and with his previous question, that closure is a very complex question, and it can be easy to think, oh, an outbreak would lead to closure, correct? And the answer to that is, well, no, not necessarily, and in fact, probably not. We really are not expecting or anticipating closures to be part of our situation at this point. If that was the appropriate response based upon the data we had in front of us, that is what we would do. But the rapid closure that we experienced in the spring, when there were just so many unknowns about this pandemic, is not what we would expect. Again, if a partial or full closure was needed at any point, we have plans in place for that if it were needed, but we are working very diligently to not need to enact those plans. And just we are all very, very aware that sending students home, as Mark was saying, does have serious impact on both our students and the various communities they're part of, amplifying socioeconomic disparities, mental health concerns, and also potentially introducing risk into the other ecosystems that our students are part of. So if we had an outbreak, we would contain it on campus with Vermont Department of Health's intimate support, with absolute diligence to make sure that we didn't respond by transporting infection anywhere else, either in our state or to other states.
And this is Natalie from the Health Department. I'll just add to that in terms of closures. You're right, we wouldn't necessarily always want to recommend that, given that an outbreak could just mean 2 cases in a setting. I also want to add that the Health Department has local health district offices that we would leverage their relationships with local towns in the event that there is concern for outbreak to spread into the local community. And as we do know from a recent CDC report, younger adults likely contribute to community transmission of COVID-19, which was observed in the southern United States this summer.
All right, we'll move on to our next question. Thank you so much, Annika and Natalie. How are Vermont colleges going to send students home safely at the end of the term? And how will they bring them back safely for the next semester?
Hi, this is Michelle from UVM, and I'll answer these questions. They're pretty easy questions in a sense that, for bringing students back safely next semester, we have proof that the plan we used in the fall worked really well. So the colleges and universities are planning to repeating this process with some modifications due to this happening during the winter. And then as far as sending students home safely at the end of the term, we're making plans now for how to do this, taking into consideration our unique populations and campuses. Some colleges are considering offering students exit testing prior to leaving, and just as we did for the arrival of students, we require families to pick up their students outside the residential halls and not have contact with others on campus. And that worked with them arriving. So we're just going to repeat things in reverse.
And this is Mark. Just to piggyback on that, the students will be Vermonters when they return home because they won't have been anywhere else. So if, God willing, we continue to enjoy the low incidence of cases and the low positivity rates that we have, they will actually be taking that with them to usually a higher risk setting, if you will, if they're an out-of-state student. So we hope we don't have to do too much to prepare them to go back home at the end of the term.
All right. Now we're talking a little bit here about COVID-19 vaccine. Will Vermont or colleges make a COVID-19 vaccine mandatory? And then some follow-up questions. How long would immunity from a vaccine last? And how effective would a vaccine have to be to achieve herd immunity? So will it be mandatory? How long does it last? And how much do you need to have herd immunity?
Yes, so the first question I could emphatically say no to right now. There'd have to be a dramatic change in health policy both at local, state, and national levels to make a vaccine mandatory for the entire population. Doesn't mean it's impossible, but it's certainly not being discussed widely at this point in time. What is being discussed widely is that there will continue to need to be this dual strategy of, on the one hand, doing all the behaviors we're supposed to do, like the distancing and avoiding the crowded areas and wearing the masks, in parallel with varying levels of the population being able to get vaccine, have access to the vaccine and accept the vaccine. And they really will work in parallel for many, many months, even when a vaccine becomes available. How long will immunity from a vaccine last is really the million-dollar question. None of the vaccines are going to be released before they've had about 3 months of experience, but that 3 months isn't going to necessarily tell you how enduring the immunity might be. The only thing we have to go on is that there are prior coronaviruses that humans get infected with all the time, that the second episode is never like the first, so there's some attenuation in the symptoms, but the reality is people can get reinfected, just not as severely. We don't actually know what that's going to turn out to be like for COVID-19 or SARS-CoV-2 virus. So an unanswerable question at this time. But herd immunity, the estimates on herd immunity are that it requires about 55 to 80% uptake of the vaccine by the population. None of the vaccines that go through the rigorous trials will be released if they have less than a 50% effectiveness rate. So clearly we need to be over 50% for effectiveness of the vaccine and well over 55% for acceptance of the vaccine by the population. Just to give you some stats, early on, about 75% of people in surveys said that they would take a vaccine, but not immediately. Usually only 30% said they would take it immediately. Nowadays, because of all the politicization associated with this, under 50% say they would take the vaccine, period, never mind early on. So clearly we need to have some faith regrown in that process to make this something that we would all want to have and would trust. And I don't think that's impossible for us to accomplish by any means.
And to piggyback there, Dr. Levine and others at our health department have been in direct discussions, as mentioned before, with the FDA and CDC to go over all of the methodologies that they are using to ensure that the vaccine is safe. And I know that the health department has a lot of confidence in that process.
Absolutely. And Dr. Fauci, when he was here as a trusted resource, was very emphatic about all the layers of safety and data oversight monitoring that's going into any vaccine trial. And he was quite confident that only the safest and most efficacious vaccines would make it to the finish line. And since then, the head of the FDA and others in prominent positions have reiterated the fact that politics will not interfere with this, and all of the appropriate scientific-based protocols will be adhered to.
I'd like to thank everyone for listening in today. I'd like to thank our panelists from the colleges and universities, not just for today, but for all of your cooperation and support throughout, all of the Department of Health staff, our commissioner, and the person who produced this webinar, Jillian Morgan, as well, with our communications section. So thanks to you, and thanks to the colleges, the students, the faculty, and community members that are all working together to keep Vermont in a good place. Again, we don't have a crystal ball, but we will continue to work cooperatively with whatever challenges come at us in the coming months. Thank you very much.